It all started in 1955 when blood transfusion became a significant topic among the people of Malaysia as a life-saving procedure. The blood bank was first run by a lady volunteer from the British Red Cross at the Kuala Lumpur General Hospital building. However, by 1958 onwards, the Ministry of Health appointed a medical officer to work part-time, and later in the same year, a supervisor was appointed to work full-time and took charge of the blood bank.
After 15 years of service, the number of blood units collected had increased to 5,830 and a total of 13,860 cross-matchings were performed. In 1971, the blood fund was transferred to a special building at the Kuala Lumpur General Hospital. The National Blood Transfusion Centre was set up in April 1972 alongside with the launching of the National Blood Transfusion Service by the Director General of Health. Blood banking services of all government hospitals in the country were integrated into one. A hematologist was appointed as the full-time director.
Starting in 1975, work regulations, methodology, equipments, training and textbooks were all standardized to ensure quality. In 2002, the new National Blood Centre was moved to its current premises, which is located on Jalan Tun Razak, Kuala Lumpur.
Today, the centre provides services such as whole blood collection, apheresis collection, referral services for transfusion problems for the country, routine and referral hematology services for the investigation and management of patients, registry, treatment and counselling for haemophilia patients, collection and storage of cord blood specimen, and raising the awareness and providing knowledge to the public regarding blood donation. Beta thalassemia is an inherited blood disorder that affects the beta chain of hemoglobin in red blood cells.
In beta thalassemia, the gene on chromosome 11, which codes for the production of beta globin, is either defective or missing.
This will cause the production of beta globin to be reduced or defective. Due to the ineffective hemoglobins produced, less oxygen is being transported throughout the body.
There are many types of beta thalassemia, including thalassemia major, which is also known as Cooley's anemia, thalassemia intermedia, as well as thalassemia trait.
The National Blood Bank also plays a role in raising public awareness regarding thalassemia.
Besides that, the National Blood Bank also discusses with the clinicians from hospital on selecting the most suitable blood specifically for each thalassemia patient and provides them with those blood that are requested.
Moreover, as thalassemia patients require more blood transfusion, there is an increased chance that they will develop antibodies.
Every thalassemia patient will have different blood phenotype. Thus, the blood bank provides phenotyping services for these individuals.
From this field trip, we learned that the blood bank requires at least 2,000 blood bags per day. For prospecting donors, there is a list of criteria to be met in order to become a blood donor. This includes age, weight, and date of last donation, if any, to name a few.
The donor's blood type and hemoglobin levels will be tested prior to donation to ensure the donor's eligibility to donate. Then, the donated blood will be tested for any blood-borne diseases to ensure the recipients will receive the healthiest and safest blood available.
We also learned that there are some myths surrounding blood donation in Malaysia. One of those is that there's this speculation that blood donation causes weight gain.
Donating blood may increase appetite, which can contribute to weight gain, but the act of donating blood will not increase weight. The most interesting part of our visitation to the National Blood Bank was witnessing the process of blood donation. As an outsider, it looked like a painful and tiring process.
We felt very inspired that these donors are still willing to donate despite all this. Seeing what others are doing for the people who are in need in Malaysia makes us feel warm and hopeful.
It was an eye-opening experience to see that these people volunteer to sacrifice their time and a part of their body to help and improve the lives of those that they don't even know.
I had my first blood donating experience. It was far from what I had expected, as I have the perception that blood donating process will be a painful experience. The process of blood collection was fast. Only the blood screening and counseling prior to donation takes time. It was a memorable experience as I have never donated blood before, and I will surely donate blood again in the future. The medical officers and nurses there were extremely helpful, and provided me with clear instructions and treated me with care during the entire process of blood donation.
It depends on the severity of thalassemia. There are many forms of thalassemia, and blood transfusion depends on case-to-case basis.
Patients that cannot support the body's demand of producing blood in time require transfusion. Usually, thalassemia major is the most severe form, thus blood transfusion is the only option for them and they require it regularly.
As for thalassemia intermedia, only when they have an infection or injury, they will need blood transfusion.
Usually, aside from thalassemic major patients, patients can manage their own thalassemia by eating iron supplement tablets or folic acid tablets. Therefore, not all thalassemia patients need blood transfusion.
Blood processing and safe transfusion are actually conducted at two different places. For blood processing, it is first conducted in the laboratory after collection of blood from patients. Then, the whole blood collection will be split into three blood components: red blood cells, platelets, and plasma.
Then, blood typing as well as screening tests are performed before the blood components are stored in appropriate conditions. Blood components that meet the standard requirements are released into the inventory. Plasma is also sent out to CSL Australia to further process it to form factor VIII concentrate for hemophilia patients. All of this is done to assure the supply of safe blood for transfusion.
Coming to blood transfusions, this is done in the hospitals. Clinicians will first discuss and request blood from the blood bank. The blood bank will provide specific blood for each thalassemia patient. This is because as thalassemia patients require frequent blood transfusions, they are exposed to blood of different and multiple donors.
Thus, by carefully filtering the blood suited for each thalassemia patient, the risk of thalassemia patients developing infections can be reduced. The goal of having effective and safe transfusion therapy can then be achieved.
Raising awareness is not something the National Blood Bank does, but the Ministry of Health. However, the National Blood Bank does play a role in this.
What National Blood Bank does is that they provide brief ideas regarding thalassemia and transfusion-related information to the public.
National Blood Bank suggests pregnant ladies to do early screening, and for those who are suspected to be a carrier for thalassemia can go for premarital screening.
Moreover, family history is very important in thalassemia. Hence, suspecting people should go for a blood checkup and screening if their results are abnormal. From time to time, thalassemia is talked about on multiple platforms including social media and on the radio.
You can use does is that they provide
Beta thalassemia is an
There are many types of beta thalassemia. Thalamus.
the body's demand